Hello, thank you for joining us for the NextGen Office Revenue Cycle Management Overview. Today, we'll be providing insight into the revenue cycle management process through NextGen Office and show key functionality in the system that will help to reduce claim rejection and denial rates, speed up the revenue cycle process to get you paid faster, and provide clear insight into the financial health of your practice. I'll be taking you through 7 specific areas in the RCM cycle. Initially, we'll start out talking about the front office workflow, and how the front office is designed to ensure accurate and current information for your patients. Then we'll jump over to the EHR and look at some of the tools there that help providers select ICD-10 codes with the appropriate level of specificity and correct E&M codes according to the E&M coding rubric from CMS. Then we'll switch gears, look at claim submission and scrubbing, and the transparency that your practice will have into what is happening with your claims. And we'll talk about how we manage accounts receivable, provide an overview of what our team will be doing to follow up on your outstanding claims. We'll then talk about payment posting and viewing ERAs. Then we'll move into our rules-based statement module, talk about how statements are generated and what they look like, and ultimately wrap up by showing our reporting tool we call Business Intelligence and the full financial transparency that you will have available on demand at any time from anywhere in the world. So let's get logged in here. Now this is a cloud-based system, meaning, again, any computer, anywhere in the world at any time. Just plug in your credentials, takes you right in. And, well, everything starts, the revenue cycle process starts with the front office. So let's start there. Now, before we can do anything else, well, we need to make sure that your patient's information is into the system. For new patients, historically, this has been a manual process, something like this. You hit register a new patient and fill in the blanks. Now, the problem with this approach is kind of twofold. One, it's time-consuming. 2, it's prone to error. Errors like, say, typing in Joe instead of Joseph, or a married name versus a maiden name, a hyphenated last name spaced correctly, all sorts of possible typos or other discrepancies that will lead to claim rejections and delayed or possibly lost revenue. So instead, what we've done is we've developed a different workflow that starts back at the home screen that eliminates all those problems. We're going to start with eligibility. Now, we're going to pick the payer from this drop-down menu. This list will be customized for your practice based off of just the insurance companies that you accept. And we'll use Aetna as the example today. Now we type in the subscriber's ID number here like this. We hit Submit Transaction at the bottom. And what that does is it reaches out in real time directly to the insurance company. And from there, pulls back all of the patient benefit information, including their copays, coinsurance, and any deductible amounts remaining. So this is a good start. Before we've spent any time doing anything else, we verified that the patient has insurance. We know that it's accurate. We know that it's active. We know what kind of benefits we're looking at. But the main reason we recommend running eligibility first like this is this button off to the right that says Create Chart. We hit that button, and just like that, all of this information is imported directly into the system, and a chart is set up in the software. So the important thing to take away from what we just showed you there is, well, of course it's very efficient. Right? It's very quick to register patients that way. But most importantly, when talking about revenue cycle management, or talking about getting paid, is that we know all of this information here exactly matches what the insurance company has at their end, meaning, well, you're not going to have to deal with claim rejections because someone typed in, oh, Sue instead of Susan, or forgot a middle initial or something like that. This will help to significantly reduce claim rejection rates. Now, if we have an established patient that's calling in to schedule an appointment, we can search for him like this. And if I scroll on down, first thing that we'll do, right when we're on the phone with the patient before we schedule an appointment, is hit Verify. That will run a real-time eligibility transaction and come back in a matter of a second telling you whether or not this insurance that we have in the system is still accurate and current. If it comes back saying inactive, it would be bold red, indicating to your staff that, hey, before we schedule this appointment, we want to make sure we get some updated insurance info so that you can make sure that you're getting paid for the visit. Now, at the same time, while we're looking at an established patient's chart, another really nice aspect of this software is that it's very easy for your staff to see if the patient owes you any money. Right? Based off of the insurance payments that were posted in the system and any patient AR that was generated as a result, well, you're going to be able to see over here, this patient owes us, in this case, $45. You can click on it, scroll down, and it looks like he's owed us $45 for quite some time. So, point being, again, easy for your staff to know what to try to collect. And now, we're going to jump on over, talk about scheduled appointments, and specifically, eligibility re-verification prior to upcoming appointments. If I jump here to the daily schedule like this, if you notice these dots by the patient's names, these dots, I scroll down here, the dots indicate eligibility status for your patients. So what happens is the system itself automatically, without you having to do anything, 2 days prior to any scheduled appointment, the software reruns an eligibility check with whatever insurance is on file in the system for that patient. And then, well, we tell you, according to a stop light signal, green is go, patients are active and covered, that's great. You see a red dot here, like Miss Mary Tyler. Well, it's a pretty strong visual cue for your office staff saying, whoa, stop. Somebody needs to call this patient, get some updated insurance information before we see them. Otherwise, it's a guaranteed claim rejection. So wrapping up the whole front office portion of this overview, the main theme is really the idea of do it right the first time. Check eligibility initially, import the information to ensure it's accurate. Rerun real-time eligibility checks for patients calling in that are established patients to schedule an appointment to make sure that they have active insurance at that point. And then every day, just look at your schedule and see if you have any red dots. And if so, reach out to those people to further ensure that this insurance information in the system, the patients have active policies. So do it right the first time. From here, we're going to jump on over into the electronic health records. Let's do that. I'm going to go up to the top here, simply click EHR, and this is what the providers will see when they first log in. This is their home screen. Now, I'm not going to go through and do a full note here on today's presentation. We'll be happy to do that for any of you if you'd like at a separate time. Rather, what I'm going to do is pull up a note that's been previously created. Here is a completed note in the system. And ultimately, the rendering provider is going to be responsible for completing their encounters, which includes charting, coding, and charge entry. Now, as the provider works his way through doing the SOAP note, as we have here, everything is done using the tabs over to the left. So as the provider works his way through the SOAP note and gets down to the assessment portion here, you'll see the system suggests diagnosis codes for us based off of what has been documented. Now, there's also an intelligent search algorithm over here as well. So if I go to ICD-10 codes and I just typed in SOB, it's going to come up with shortness of breath. That's to say COPD. Well, it's not just coming back with chronic obstructive pulmonary disease, but also a number of potentially related codes. I was to type in FRAC, R, MEDIT, INIT, DISP. Well, that's gibberish. Those aren't even words. The system still returned displaced fracture, first metatarsal bone, right foot initial encounter. Point here is providers don't have to spell words correctly. They don't have to be in the right order. They don't even have to be words. The system will still help you identify appropriate codes with appropriate specificity. So between the suggested coding tool, the intelligent search tool, or of course the ability to pull forward from patient's history or problem list, we make it easy for providers to get their diagnosis codes. Now, any tests that are done in the office, say rapid strep test or urinalysis, or maybe any like an in-office X-ray, any procedures, tests that are done, that will automatically drop the appropriate CPT code to the procedure coding panel. If I go down here, in this case, as part of this note, I had ordered an in-office X-ray, hence that code is right there. Now, on the procedure coding page, once the provider selects the level of complexity up here, that's up to the provider. based off of their assessment of risks, stuff like that. Well, once you pick the complexity, you go up to this E&M coding tab. This is going to tell us, according to the 1997 E&M coding guidelines used by CMS to determine the level of the visit. Well, according to those guidelines, this is a 99203 for this new patient. Now, if we click on any of the tabs here, right, because the E&M code is made up of history, examination, and complexity. By going to any of these tabs, it's going to show us why, why this was, say, a level 3. In this case, I reviewed 17 elements. I needed 12 and 2 or more to get to detail. If I go to history here, I can see I did a really good job with my HPI. Did a good job with my review of systems. But looking down here at the medical, family, or social history, this is sitting in the detailed column because I only reviewed one history. If I would have done one more, that would bump it up to comprehensive. So the idea here is that not only is this E&M coding tool something that helps providers rest easy, knowing that their coding is exactly in line with what CMS would consider to be, in this case, a level 3 office visit, but it's also an educational tool showing what would be required to move up to the next level of visit to ensure that providers are getting reimbursed appropriately for the work that they're doing. Now, in this case, I'm just going to go ahead and accept this 99203 here. And after looking over this tool, that places the 99203 down here as a service line. So after reviewing and selecting your E&M code, clicking this blue button right here, this Generate PM Billing, will create a completely filled out CMS 1500 claim form with all the necessary claim data. And this claim is going to sit in what we call user hold status pending our professional billing staff's review. So at this point, we're going to jump over to the billing side of things and show where we start the billing cycle. But just wrapping up on the EHR side, the important thing to remember here is we make it easy for providers to code appropriately and correctly so that ultimately, well, as they're completing their encounters, this data is getting sent over to our professional billing staff in real time. Now, I'm going to jump over to the practice management, to what we call our day-end review screen. And the day-end review screen, well, this screen helps your practice to ensure that claims have been generated for every patient that was seen that day. So kind of some checks and balances for you on your end. You can make sure that, well, see here, we have a claim ID. That's because I just hit that blue button that said Generate Billing in the EHR. For all of these others, where there's no claim ID, it still says Enter over here. That's because either A, the provider didn't do a note, or B, they did the note, but they forgot to hit that blue button. So again, what this is designed to do is provide complete transparency to make sure that you know that every claim, or every patient you saw, has a claim that's been created and associated with that visit. Now, this is going to list out a summary down below as well. So at the end of the day, you should expect to see 0 missing charges. Now, this is where our billing staff is going to start the billing cycle. So our billing team will see the claims that show up over here, like this one that we just sent over that's in user hold. And our certified billers are going to open the claim and then edit it. And there are the codes that were sent over from the EHR. So we're going to manually review the encounter to confirm the appropriate diagnosis pointers, modifiers, and payer edits on it. They may reorder the line items to maximize payability. But just as a point of clarification, our billers will not open every note and confirm all charges were captured. If there are needed changes to the codes or charges, we'll reach back out to you, reach back out to the provider to correct these. Reason being is that CMS does not allow third-party vendors to change codes or charges as they look at this as a potential inducement. But again, we will manually review that. And in this case, what we'd see is that, well, we need some diagnosis pointers here. I'm going to want to put a 25 modifier in there. And I don't have a fee set up for that in-office x-ray. Okay. So I've just made some changes. Right? Find diagnosis pointers, entered a modifier, modified the fee. Now, after the claim is reviewed manually, they will then run it through our claims scrubbing tool, which is called Denial Defender. It looks like this. And this is a secondary scrub. It's going to calculate relative value units so we can make sure that service lines are ordered appropriately. Tell us under modifier columns here if the modifiers are appropriate that we're trying to use. CCI are going to look at some bundling edits to tell us whether or not two codes are mutually exclusive with one another, or maybe one code can be billed if and only if a certain parent code is billed. So basically, this is a very robust claims scrubbing tool that'll help us, after we've manually reviewed it, help us scrub it one more time. Then we're going to go down, and when we create the claim, we're going to drop it to the clearinghouse. Our clearinghouse scrubs it again according to EDI edits. And when it passes those, what will happen is that you'll see back at the day end review screen we were at here earlier, once we go through and review a claim, scrub it, drop it to the clearinghouse, the status for that claim in real time updates to say accepted. It's going to be green text. That evening, once the claims are batched and sent out, the status would update to say sent to payer. So you're going to be able to see the status of all your claims right here. So what you can do with this is you can come in the morning and look backwards at yesterday's schedule, and you should see sent to payer down the column here. You'll be able to see there's 0 missing charges. So this is, again, a way to have full transparency for your practice to ensure that claims are not only created, but they've been submitted and successfully transmitted to the insurance companies for every patient that you saw. Now, you're also going to be able to see kind of a more broad overview of the status of your claims in this screen, which is our claims management screen. So this is kind of a 30, 60, or 90-day window. This is where you can see if there's been any rejections or denials or any claims that are left in hold pending additional information from the providers. Now, there's nothing that you would need to do on this screen. We will be working all rejections, denials. We will be appealing claims and appealing partial payments or unpaid line items for you. But if you ever wanted, again, you're going to have full transparency to be able to come here to this screen, look at it, and if you see anything in the rejected or denied tabs, you can always go in there and click on it to see the rejection reason and any of our notes that we may have entered down here as far as what we've been doing to resubmit that, dates and times when it has been resubmitted as well. Now at this point, we're going to go ahead and jump on over to the account receivable page, insurance AR. Billing, AR ledgers to my insurance ledger here. Now if a claim is not paid or not paid in full, we will work all insurance accounts receivable. This includes following up with payers on outstanding claims, working these different aging buckets, right? The typical 30, 60, 90, etc. This also includes appealing denied claims, appealing unpaid line items on a partial payment. It includes us doing underpayment review of the payments that come in. We will resubmit claims requiring corrections. We'll resubmit claims that for some reason may get lost or somehow don't make it to the payer. And we will also take care of any requests for additional information from payers, such as providing proof of medical necessity or printing medical records or anything like that. We will make sure to work all insurance accounts receivable until it is paid. And you can see at any time exactly what your AR is looking like. So at any point in time, you can see as of right then what's outstanding in your AR. And you can navigate through here as well if you wanted to have, well, a little bit more transparency. Say I wanted to look at the 121 bucket, click there. And, well, maybe we want to look at our Aetna claims. So these are claims outstanding over 121 days with Aetna. Or we can drill back up and we can look at claims with, say, United Healthcare. And I'll go into one of these specific claims and look at the history where we see the claim was received by the payer. That's good news, right? But, well, why hasn't it been paid? Now, if I go in here and kind of scroll down, again, going back to the idea of complete transparency, you will be able to look at any of the claims like this, see our notes that we've been entering as we work on these claims. And so you can kind of see what's going on behind the scenes, so you know what's going on with these outstanding claims. And again, please remember, you're not having to do any of the work with regards to working your insurance AR. That's something that our professional billing and coding staff will be taking care of. But this is designed to give you kind of an idea as far as what kind of oversight that you'll have, or again, transparency that you'll have into being able to see what we are doing. Now, at this point, we're going to jump over into looking at payments, right? Because we've done a good job making sure that claims have been created and submitted to insurance companies for every patient we saw. We did a good job making sure that there were no rejections or denials. We've done a good job making sure that, well, we're keeping an eye on all of our aging buckets. Now, I jump over here to payments, specifically to ERA. We will post all payments for you if they come in as an ERA or electronic funds transfer, as well as if they come in as a paper check. For anything that comes in as a paper check, we have an HL7 secured interface for you to scan it and directly send it over to us so that we can take that information from the EOB as well as the payment information posted in the system to balance out your insurance ledgers. Now, ERAs that are coming in, they'll be coming directly into the system, and they can be viewed in PDF file format right from the dashboard. So I go to all here, and I wanted to look at the payment information for this check, this $1,000 we got. Click the date. There's a quick kind of summary. And we'll hit PDF. And, well, there we are. There's our EOB, or ERA. So you're free to look over these. But again, remember, you don't need to do anything with these because we will be taking this using our intelligent auto posting tool, auto posting those, manually posting areas where we need to, again, appealing unpaid or underpaid line items. Also, from a patient's chart, if you're looking at any patient AR, and we'll go back to a patient chart here. If you're looking at any patient AR, you'll be able to see with just a couple of clicks the actual ERA associated with that claim to help explain to a patient why they have a balance. I'll look at Benny Tyler here, and I was to go into his, well, claim history, or actually, let's see, if we go to the ledger here, and if I was to look at one of these claims and hit details, the ERA would be linked right down here. Now, this is a fake claim in this demo account, of course, so there's not an ERA there, but if this was a real claim that actually had ERA payment information associated with it, very easy to see that and print it out. Now, as we're posting all of your payments, as the checks are coming in, as we're auto-posting electronic remittance advice or manually posting your paper checks and paper EOBs, well, we're going to need to collect balances from your patients. Right? There's going to be patient responsibilities, co-insurances, deductibles. So we're going to want to send some statements. I'll go here to statements like this. Now, we can run your statements on your behalf, or you can do them internally. The NextGen Office Statements module is a rule-based engine that allows you to set up certain parameters, such as anything that is over 91 days in AR with a minimum balance of $20. Or, say you could say anything that was skipped if generated in the last 30 days. I could do something like, setting up the rule behind the scenes not to generate or send out if it's been more than 4 statements sent. Now, once you set the parameters here, you can have the module run weekly, queue all patients that fall within those parameters, and that'll create a statement batch. The batch over here, if we were to click on it, that would bring up 5 or 10 or 500, however many statements are in that batch for bulk printing. So they're generated in a batch for bulk printing, but they're also parsed out individually to each patient's chart. So if a patient calls in asking why they have a balance, it's very easy for your staff to open up and view the exact same statement the patient's holding. Go here and search for Roy. And if this patient's calling in because he got a statement and he doesn't understand exactly what it's saying, you can just simply pull up his chart, scroll down a little ways, and right here is the statement history with any statement we've ever sent to that patient. Click on it like that, and it's going to open up as a PDF file. So just like that, pull up a patient's chart, scroll down, click the link, and you're now looking at the exact same thing that the patient's holding in his hand. And we get a lot of positive feedback about our statements, namely because all statements that go out include this level of detail. You'll never see a statement that goes out of our system that just says balance forward or something esoteric like that. They all contain the provider name, the insurance we billed, the code, the charge, the adjustment, the insurance payment, the patient responsibility, reason it looks like he owes us money because he had a deductible outstanding, and then any statement messages that you would have included on there as well. And those are what our statements look like. Now at this point, let's go ahead and wrap up by talking about reporting. Reporting is done using a tool we have called our Business Intelligence tool. Jump into that database here and pull up my report section. Now, Business Intelligence tool contains dozens of pre-built or what are sometimes referred to as canned reports, as well as almost unlimited customizability using what we call analysis grids. So we'll start off by showing just a couple of canned reports. The first thing we're going to do is pick the report type. I go down here to practice performance and run one of our more common reports, practice month-end performance. So hit generate report. And in the grand scheme of things, it's an incredibly fast reporting module. Maybe 5 to 10 seconds while it crunches data and brings forward real-time data as of this moment. And here we are. So we can filter this by provider or certain locations or by just looking at this for different insurance payers. And just a couple of really important things to highlight first. Days in AR over 120. Total days in AR, days to bill, days to pay, gross net collections ratios, total applied payments, deviations. And this contains a lot of information. Now this is also customizable if you wanted to get rid of some of this and trim some of this back. If you didn't need all of this information, you could, but just being able to run this on demand gives you a really good insight into what's going on. Again, with most of the really important data points being right up at the top here under AR, charges, and payments. That's the practice month end. Now, another report we'll show you is our E&M coding report. I'm going to go back here and select a different report to production. And I'm going to look at the, let's say, E&M charge performance. So this is going to look at all E&M codes we've built out over whatever time period. So let's just say, well, it's the beginning of this year. Now, if I wanted to filter it, if we have a multi-provider practice and I wanted to apply some what we call global filters, we could do that right here. We could look at E&M charge performance just for, say, Medicare, right? Or just for 99215s if you wanted to filter it. I'm not going to apply any filters here. I'm just going to generate this report. And just a matter of seconds, it's going to come back and break down all of our E&M charges, in this case, new patients, established patients. Kind of nice here too, because it provides the Medicare expected code usage bell curve. And this, well, there might be some red flags over at CMS based off of the fact that this practice is billing out a majority of level 1 and level 2 visits, and it's not really what CMS would expect. So there may be some issues with your coding. Now, there's another interesting way to analyze your reports through what we call a forecast or a growth report. So let me go back and jump into practice performance. Look at goals. So it's one thing to be able to mine existing data out of the system, but this actually takes it one step further in allowing you to add specific goals here. Say, if you want to increase charges by 5%, and you can set those trend lines to look forward, and then also retrospectively look back and see how you're doing. And we'll work with you to, again, show you and train you how to customize all of these, how to run all these reports. And keep in mind, you can access those reports, again, anywhere in the world at any time just by logging in. So you can do as much financial analysis as you want on your own practice. Excuse me. Now, last thing we're going to do here is look at a few different what we call analysis grids. So if I go here to select a report, specifically, I'm going to look at this production category once again and look at my service line detail analysis grid. Remember, anything marked as an analysis grid here is completely 100% customizable. Now, if I wanted, because this particular report you see in the summary up here, it breaks down, well, service line information, right? Procedure codes, charges, adjustments and payments, etc. So I could use this report to look at, let's say, charges and payments for just say these two different insurance companies here for, say, one specific procedure code. So you can kind of compare to see who pays you more or less on average, right? So there's lots of things that you can do as far as applying global filters to kind of focus the data set. No, I'm not going to do that. I'm going to just generate this report. And if we don't, oops, I forgot to pick my time period. And if we don't apply any global filters, it's just going to pull all of the data. It takes a couple seconds to run once again. And it brings us back a ton of information, what we, well, elegantly call a data dump. So there's a lot of information, and this is not really telling us much of anything. It's just raw data. What we're going to do is we're going to make some sense of it by clicking this little gear here. This asks us what data points we want to see. So I'm going to say, I want to look at a breakdown of payments by rendering provider, the procedure code, charge, adjustment, patient responsibility, insurance payment, patient payment, total payment. Yeah, let's add the payer on there as well. Now at this point, what I'm going to do is drag the payer column over here like this, click here, group it up. Now if I wanted to click on the charge column header here and say I want an aggregate sum total in this column, we do that. And I'm going to get an aggregate sum total here on total payments. Now, just like that, we've customized a report. Hide those gears. And if you're the type of person that really likes, well, charts, data tables, spreadsheets, numbers, great. But if you prefer to visualize this, you can always add a chart to this. Let's add chart here. Go ahead and add a pie chart. And I'm going to look at this breaking down primary payer by, let's say, charges. Make that a little bit bigger here. There we go. So we have a pretty wide mix of different insurance companies we're sending claims out to. If you wanted to change this, instead of looking at charges, I want to look at total payments. Interesting. So again, lots of different ways that you can look at this. You can customize your own data tables in these analysis grids. You can create your own charts, whether it's a pie chart or if I wanted to do a bar chart or something like that. All of these reports can be exported into Excel, CSV, or PDF files. And once you go through and play around with this a little while, maybe customize a few of your own reports, come up with some reports that you really like, you can go up top here, say Save Bookmark, call it whatever you want. And if we hit save, that report is then going to be available up top here in your bookmark section. And I've created lots of these different bookmarks over the years. You can group them. You can set up sub-filter or subcategories here like this, and then go through and run any of these that you may have created on demand. You can also schedule them to run on certain intervals so that they're just waiting for you without you having to even go in and pull them up yourself. And one last thing here while we talk about reporting, just to wrap up, is that you're going to have a real-time dashboard set up that helps you to, well, visualize anything that you may want to set up on here. You can customize all of these based off of what you've been doing with those custom reports you've been creating. You can use a lot of these pre-built tiles that we have. This is something that our staff will help work with you on to learn how to customize and set these up, so that again, you have an on-demand visual representation of what's going on with your practice. So just one last key point. Hopefully as we went through, this was helpful for you folks today, and you were able to pick up on a really key theme in our software here. And again, with regards to revenue cycle management, the theme is transparency. We want you to know that we are working hard on your behalf. We want you to be able to see that and have access to be able to get in and run your own reports, see your AR, see what we're doing as far as working claims. So that said, thank you all for joining us today on this overview of revenue cycle management with NextGen Office. If you would like a personal one-on-one presentation of anything that we covered today or anything else as far as the software or our revenue cycle management services, please contact your sales representative to set that up. I hope you all have a great day, and we look forward to partnering with you to ensure the continued financial health of your practice.